Hello, I'm Kevin Reynolds. I'm a gynecologic oncologist and a member of MIOCA's Medical Advisory Board. We're here to talk about ovarian cancer today. Ovarian cancer is a very deadly disease. It's one of the 5 leading causes of cancer deaths for women in the United States. It's a disease that's particularly treatable if caught early. Our biggest challenge is that only 15% of ovarian cancers are caught in early stage. Ovarian cancers are often treated with a combination of both surgery and chemotherapy. Disease that is caught early is often curable. One of our most important goals then is to find ovarian cancer at an early stage. There is no early detection test yet approved or proven for ovarian cancer. This is very different from mammogram, for example, that's widely used to detect early breast cancers. Until we have a more reliable early test, we're very reliant on women recognizing early symptoms of the disease. You'll hear about these symptoms from other cancer survivors in this video.
Hi, I'm Deborah Frick. I'm an 8-year survivor of stage 3C ovarian cancer. Approximately 90% of women report being symptomatic before their diagnosis of ovarian cancer. Like many women, I was not educated about the symptoms of ovarian cancer, which is especially surprising given that I'm an oncology nurse. I simply did not know what my body was telling me. There are 4 symptoms which have been statistically shown to occur more often in women with ovarian cancer compared to women in the general public. It is critical that females are educated about the warning signs of ovarian cancer because the symptoms can mimic other common conditions or illnesses. If you experience any of these symptoms at least 12 times in 1 month, please contact a doctor, preferably a gynecologist.
Hi, I'm Deanna Cousins, and I'm a 5-year survivor of stage 3C primary peritoneal cancer. And looking back, I remember feeling bloated in my lower abdomen 2 months before my diagnosis and as I was being fitted for my dress for my son's wedding. The need to let out the waistline of my dress when it should have been ready to wear was a clear signal that my body was becoming bloated. Now, at the time, I knew nothing about ovarian cancer, so I attributed this symptom and others to postmenopausal symptoms and weight gain. I further rationalized it by recalling my seemingly healthy annual physical. Regretfully, my diagnosis was delayed as my doctor connected my symptoms to other conditions.
Hi, I'm Marcia Gershie, and I'm a 16-year survivor of stage 3C ovarian cancer. As a child daycare provider, the ability to be active is essential. When I began to experience symptoms of ovarian cancer, it was abdominal pain that made working nearly impossible. I can recall the need to crawl on the floor as I interacted with the children. Not surprisingly, my diagnosis was delayed as tests were run that were unrelated to ovarian cancer. If there's one recurring theme among survivors, it's that many of us regret that we were not more proactive in our initial diagnosis. Many of us knew there was something seriously wrong, yet we listened as our cancer was explained away to a less serious diagnosis. Many of us regret that we did not insist on more tests with less time between each test.
Hi, I'm Michelle Shepard, and I'm a 13-year survivor of stage 3C ovarian cancer. Although I had all of the symptoms for ovarian cancer, the most memorable for me was feeling full quickly. Several months before I was diagnosed, my family ordered takeout for dinner. As I filled my plate, I remember thinking how great the stir fry smelled, and I felt really hungry. I sat down at the table and I took a few bites and then just put my fork down and enjoyed the conversation with our family. My teenage son, though, noticed that I had stopped eating and asked if my food was okay. I said that it was odd because I had only eaten 4 bites and yet I felt full. It wasn't that I felt nauseous, I just felt full, like I had eaten a really big meal. Over the next few months, that would become the norm for me. I didn't know what my body was telling me because I didn't know the symptoms of ovarian cancer. I dismissed increasing symptoms because I'd been previously told that I might be experiencing early menopause given some changes in my body. By the time my cancer was diagnosed, it had spread to my lymph nodes, and I was diagnosed with advanced ovarian cancer.
Hi, I'm Nancy Evanson. I'm a 5-year survivor of stage 1C ovarian cancer. My journey began with a single symptom of ovarian cancer. 3 mornings when I got up, I felt the urge to urinate, but when I tried, nothing came out. It didn't hurt and it didn't smell. It was just weird. It didn't recur throughout the day or night until the next morning. When I called the doctor, they insisted I come in to be checked. My doctor ordered a transvaginal ultrasound. The diagnosis was stage 1C ovarian cancer. I feel like the luckiest person in the world. I'm lucky that my symptom was strange enough to get my attention. And I'm lucky that the person at the doctor's office insisted I come in right away. And I'm really lucky that my doctor was alert to the symptoms of ovarian cancer, even though I was not. She knew that a change in urinary urgency and frequency is a warning sign. And I'm lucky that she also knew to refer me to a gynecological oncologist. This is an example of everything going right.
If a woman displays symptoms of ovarian cancer, experts recommend that a CA-125 blood test, a pelvic rectal exam, and a transvaginal ultrasound be done. Because ovarian cancer affects females of all ages, our message is important to everyone. When it comes to ovarian cancer, until there's a test, awareness is best. For more information about ovarian cancer, visit mioca.org.